Bacteria Project by Katy Q and Jacob Mcnew. In the Army Medical Corps, some of the biggest diseases were dysentery, typhoid, pneumonia, tuberculosis, malaria, and measles. These diseases were not very treatable, and if there was some medicine for them, they most likely didn't have enough money to afford it. Measles were a very contagious infection that caused a rash over your body. Dysentery is inflammation of intestines, which cause severe diarrhea and blood and mucus and feces. Typhoid is an infection that causes diarrhea and a rash. Tuberculosis involves the lungs and is caused by Salmonella typhi. Malaria is a parasitic disease that causes high fevers, shaking chills, flu-like symptoms, and anemia. Pneumonia primarily affects the alveoli and the lungs. The medical procedure that added the most problems for this time would be amputation, which was helpful sometimes until after the surgery because it would allow the wound to get infected by bacteria and could potentially kill them. Some of the implements and tools they used, if not properly sterilized after surgery, could cause the disease to be passed on. Many factors that attributed to the fact that the soldiers died. Garbage in the camp, overcrowding, and poor hygiene are one of the top three. This combination creates an incubator for disease to spread and develop. Hand hygiene became a common practice in the medical field. When Dr. Ignaz Semmelweis discovered the disease was becoming spread more rapidly by those who weren't washing their hands to those who were. When people started to wash hands, they saw the death rate drop from 25% to below 1%. When you wash your hands, make sure you start with warm water. Massage your hands in the water first and then add some soap. Lather up the soap for about 10 seconds and then place it back under the water. Make sure to get underneath your fingernails and in between each fingers. A lot of people miss the top of their hands and in between their fingers and around their wrists. So make sure you get these areas to include proper hygiene. There are many different ways to show how antibiotics work, but here are two. Bactericidal kills bacteria, and bacteriostatic sticks to bacteria, and it works to get rid of the bacteria. Antibiotics are important when it comes to getting sick. We in today's age don't deal with it. We take something for that, and sometimes the antibiotics save your life from something deadly. There are 5 bacteria, and they're examples of what they can cure. Amikacin can cure E. coli. Streptomycin can cure tuberculosis. Spectomycin can cure gonorrhea. Telithromycin can cure pneumonia. And spiromycin can cure mouth infections like thrush. Other ways you can take precautions to protect against bacterial infections would be wash your hands, avoid sick people, visit doctors often, and be aware of your surroundings. Some good types of bacteria would be probiotics. Lactobacillus acidophilus is used in yogurt cultures. Escherichia coli, or E. coli, has some non-pathogenic strains that hold therapeutic values. Friendly strands of E. coli can prevent and treat ulcerative colitis. Antibiotic resistance occurs when an antibiotic loses its ability to effectively control or kill bacteria growth. If resistance to treatment continues to spread, our interconnected high-tech world may find itself back into a time before large medical advances. $10.7 to $15 million in societal costs can be attributed to antibiotic resistance. It may be an inherited trait of the organism that renders it naturally resistant, or it may be acquired by means of mutation in its own DNA. To date, there is no added health benefits for consumers using soaps containing antibacterial ingredients compared with using plain soap. They are effective in killing bacteria. It has been found where the agents were used continuously, but the modest increase in resistance has yet to be a clinical problem. Some antibacterial examples would be mouthwashes, garbage bags and plastic wraps, textiles and carpet underlays, toothpaste, surface sprays, hand lotions, cleaning cloths, window cleaners, disinfectants, soaps, and detergents. Some bacteria become resistant to almost all of the easily available antibiotics. They can cause serious diseases, and this is a major public health problem. Some examples are MRSA, VRE, and multi-drug resistant mycobacteria and tuberculosis. They can be passed from person to person within a community. Minimize unnecessary prescribing and overscribing of antibiotics. Complete entire course of the prescribed antibiotic. Practice good hygiene. Wash hands before and after food handling, going to the toilet and changing nappies. Use tissues to blow or wipe your nose. Do not spit. Stay at home if you're sick. Do all of these, and it has not been established about preventing or treating drug-resistant infections or resistance.